Hello, Nora. Great to see you. Hi, Ashley. I'll give it one more minute and then we'll start the process. And I'll start slowly to give some of our other colleagues a chance to join. Okay, I think I'll slowly start to kick us off now. We're being live streamed and I know that we've got many colleagues in the room, so I don't want to hold anyone up any longer, but I will prolong my introductions to give everyone a few more minutes to join before the main event starts. So thank you all so much for joining us here. It's super exciting to have you all back for our first in quite a long time for a Women in Dev event. It has been a while. So thank you so much for making the time. It's great to see so many familiar faces. Hi, Tikhala, I can see you've joined us. Looking forward to you contributing shortly. So to start with, let me just tell you a little bit about what the event today is going to be, what the vibe will be, what we hope the outcome from the sessions will provide us. So first of all, Women in Dev, as you all know, is a network for women who are working at all regions of the world within the international development space, who are working to advance gender equality within the space and more broadly. And that is what brought us together in 2020 for our West Women in Dev conference, which was amazing. And then since then, we've had a number of different webinars and conversations with you all along the way. And so we're really excited to bring you all back here today for the next in our Women in Dev series of events. So this event is a little bit different and it's an experiment, so bear with us. But essentially where it has come from is a discussion that many of us were having about how within our circles and within our work, so often we end up in a bit of a vacuum and we forget that there's so much other work that is happening within the gender space that we might not know about. And actually it came from a discussion about donors themselves and how so often they know so little about the broader work that is happening around gender equality. And so we started to think about like how would we create a visual that really showcases the work that is happening to progress gender equality? So that was kind of the starting point of the discussion. So we came up with the idea of having a visual designer join a session that really discussed the work that was happening in the gender space. And that is kind of where we are today, except that it went from being one session to a series of 5 sessions because we started talking about, well, what about climate and gender equality and global health and gender equality and all these different spheres that intersect with our work towards creating a more gender equitable future. And so that is where the Tapestry series has come from, creating the tapestry of the gender space and all the work that is happening. And what we hope will happen by the end is this incredible visual that showcases some of those relationships and overlaps and the work that is happening across these different spaces. So I'm excited for what this is hopefully going to yield. But this is our first session and we're going to be very much focused on global health in this first session. So I'm very excited to be joined by a number of speakers who are going to help us start to create this visual. Now, I want to start by saying that we know, of course, that this is not going to capture every single piece of work that is happening in this space. This is just the starting point. And we have selected those speakers intentionally to try and create that overarching picture of some of the big work streams and big relationships and projects that are happening and some of those really critical themes around global health and gender equality. So hopefully they will help give all of you a bit of a picture of what's happening, but really add to this visual as well. So on that note, I'm going to start by going around the speakers and asking them to introduce themselves. If you could just give your name and your organization, a little bit about the organization, and then we'll move into the wider discussion. Now, for those of you who have been to a Women in Dev event before, you will know that this is a super informal event. There's no pressure. It's just about having a conversation between colleagues about the work that's happening. And so again, I urge the speakers, you know what it is that you want to speak about, you know your areas of expertise and things that you want to make sure get into this visual. But if someone says something and you want to come in, let me know, raise your hand, and we will make sure that we come back to you so that we can really drive that dialogue and that discussion. So I'll go around the room of speakers then, and I will start with Neha. If you'd like to quickly introduce yourself and say a little bit about yourself, that would be great.
Thank you. Hi, everyone. My name is Neha Mankani. I'm a midwife and I'm a public health specialist. I'm based in Pakistan. And I'm the Southeast Asia Regional Coordinator for the PUSH campaign. And for the PUSH campaign, some of you might be familiar with it, it's a 10-year global campaign for midwives, and it works around driving reductions in maternal and neonatal mortality and around SRHR. And it kind of addresses barriers that occur in women's leadership in the global health workforce. Thank you.
Thanks, Neha. Tikhala, over to you.
Thanks. Hi, everyone. I'm Tikhala Itaye, and I'm the director of Global Movement Building at Women in Global Health. And for those who don't know, Women in Global Health is an organization with pretty much one of the largest network of women and allies who are working together to challenge power and privilege for gender equity in health. And yeah, based in Malawi, excited to be here. I'm a human rights lawyer by profession and so passionate about gender justice and women and girls' rights. Thanks.
Thanks, Tikhala. Juna, over to you.
Thanks, Rachel. Hello, everyone. Good morning, good afternoon, good evening, wherever you are. I'm Juna Turalde, Vice Chairperson of SheDecides Guiding Group. SheDecides is actually a global political movement working towards change on bodily autonomy and sexual and reproductive health and rights. We're composed of champions, including governments, civil society organizations, youth leaders, parliamentarians, activists, researchers, media, donors. So yeah, happy to be here. And actually, Tikhala was our previous chairperson. So happy to reconnect.
Thank you so much. And Kristy, over to you.
Hi, everyone. I'm Kristy Kade. I'm the CEO of White Ribbon Alliance. And before I say a bit about WRA, I just really want to thank Rachel and Women in Dev for putting together the Tapestry series and bringing us all together. I'm really excited to have this conversation. For those of you who are less familiar with WRA, we advocate for women's health and rights and gender equality. And we really believe that change happens through locally led action and global solidarity. Our network is made up of over 200 local partners in 83 countries and tens of thousands of individual mobilizers, organizers, and activists. And I'm looking forward to sharing a little bit more about our work and what that's illuminated to us.
Thank you. So we've got 4 speakers, 1 hour, 50 minutes, because I took so long with my intro. So I'll move swiftly over to you, and I think I'll start with Tikhala if you're comfortable. What I think the panelists will notice is that we've got 2 global movements on this panel, and I think that's really important as we start to talk about how we advance gender equality and what is the makeup of the collective effort to drive forward progress in this work, and why is it so critical that that work is led by these grassroots chapters and movements. So Tikhala, if you're happy, I'd love to start with you to talk a little bit about the work that Women in Global Health is doing to advance progress in this space.
Great. I was just about to start talking over mute, and you can never get used to the mute button. But can you all see my screen? Yes. Perfect. So as I was sharing with just the work that Women in Global Health is doing, just to give you a snapshot as well. So We have about 41 chapters, and we're working globally, and that's in about 37 countries. And majority of the chapters that we're working in low middle income countries. And when I say chapters, these are just networks with different women allies representing different global health professions. Many are health workers, many are working in the academic space and global health, and we work with these different women networks all over the world. So this is just kind of to give you a snapshot on where we are and the different chapters that are coming together as well, and those that are highly interested to set up as well. So you kind of have an image on where our footing is. So to kind of kickstart, I wanted to kind of give you an overview on the big issues women in global health is working on. And many of those are very familiar and many that we can all relate to or have seen or have read about. The first thing is around the gap in just leadership, especially women leadership when it comes to global health. One of the key pieces that we had noted as Women in Global Health and had been so strongly involved in when it comes to advocacy had been around the COVID pandemic itself. We had seen the establishment of COVID-19 national task forces. And when we took time to actually review the different national COVID task force, we found that majority of these task forces were being led by men. And only about 3.5 of those task forces had gender parity. And this kind of lack of representation is a symptom of broken system where governance is not inclusive, where gender equity is not present, especially when it comes to decision making and issues affecting women and women healthcare is not being brought to the table if their voices are not equally represented in these key decision making platforms. The other kind of key kind of stats and data I really wanted us to kind of pay attention to before I kind of share on some of the work Women in Global Health is doing. Many of you should have read and known about the report we did with World Health Organization, delivered by Women, Led by Men, where we really emphasized on just the leadership gap that is in there. You see that majority of global leadership spaces, especially at a higher level, whether it's ministers of health, whether it's heads of global health organizations and boards, majority are led by men. And if you go at the lower, if you see from just even this graphical representation, you see how a lot of the work that's being done on the ground is led by women, but they're not actually as many action leadership positions leading the work that's being done on the ground when it comes to global health issues. And another kind of key piece of work and key data to also bring your attention to is the fact that women contribute an estimate of 3 trillion to health annually, of which almost 50% of that is unrecognized and unpaid. And I'm going to talk more about our Pay Woman report that we recently published that's really bringing out this key data around the unpaid and underpaid work among health workers. So just kind of giving you this snapshot on all the key stats and the work that we're doing around the leadership gap in global health, or around looking on issues of unpaid or underpaid work among health workers. Some of the initiatives that Women in Global Health has been leading has been on the Gender Equity Hub. And this piece of work has been done with the World Health Organization and the Global Health Workforce Network, where the hub convened key stakeholders to accelerate progress on addressing gender inequities in health, really looking at the WHO Global Strategy on Human Resources for Health and how they could work together to promote gender transformative approaches. And through this collaboration, Women in Global Health did work with them on a report, which I shared earlier on, delivered by women and led by men, which really brought out some of these key issues that I was mentioning earlier on, how women deliver global health, but majority are men leading these global high-level decision-making committees at national or global level. And also having to bring out issues of workplace gender bias and discriminations and inequities that are systematic, that are still key issues that as Women in Global Health, we are advocating for and looking to address, especially when it comes to engaging with key government stakeholders to adopt gender transformative practices that do away with workplace gender biases. As mentioned earlier, some of the key findings that came out of this report has been how women in the global health are underpaid and often unpaid. Another initiative which I will talk about as well, and an issue that came out from this report, has been workplace violence and sexual harassment in health and social sector, which is always widespread, but often hidden and underreported. And the last kind of key issues has been around occupational segregation by gender, which is so deep and universal as well. So by just these key findings that came up from this report that we worked on with WHO, these have been some of the key issues as Women in Global Health in our own policy priorities we've been working with different stakeholders and partners to advance. So just on that note, a few weeks ago, for those who had been following our Twitter page, we had launched our Pay Woman report, and we're going to share a link of that in our chat. But it really takes you through different case studies and findings that we found through our data research that examines the unpaid and underpaid work that is being done in health systems, and estimates about at least 6 million women working underpaid or severely underpaid in our core health systems. And you know, the data is just so alarming, and it kind of makes you think to ourselves, you know, what is actually being done to subsidize this unpaid work, to kind of recognize this unpaid work that is being done by many health workers, which majority are women. And another kind of key initiative we wanted to kind of share with you that we have been leading on has been the Gender Equal Health and Care Workforce Initiative. And this is something that we've been working with the government of France, together with the World Health Organization, that's really aiming to drive gender transformative action in the health and care sectors. And the key aim here is to really engage different government stakeholders to commit and to be part of this initiative, and commit to key 4 pillars that we had set out with the government of France as well as WHO, that's really looking into, firstly, increasing the proportion of women in health and care leadership roles, looking to recognize the value of unpaid work and care work and the importance of equal pay, protecting women in the health and care against sexual harassment and violence, and also ensuring safe and decent working conditions for all health workers everywhere. So this has been a really big piece of work, and we have many governments, especially from low middle income countries, others from developed countries, where governments have been making commitments and statements to really say, you know, we're coming on board and we want to advance these core 4 pillars in the work that we're doing in transforming our health systems, taking into account these 4 pillars. And this has been work in progress that we've been doing with WHO. And one of the key pieces of work that we're doing as Women in Global Health and our different chapters is leading in advocacy and holding our leaders accountable on these key 4 pillars that need to be institutionalized in our health system. And lastly, you know, there's so much to share on the work that we're doing, but I thought we could just give you a bit of a snapshot on the key work that we have been leading and advancing and the key issues we're looking at. But this is also another big issue in global health, has been around preventing sexual exploitation, abuse, and harassment. And many of you should be familiar with the DRC case that happened about a year ago. And, you know, this was a case around a lot of allegations and cases, and an investigation had gone around where they found World Health Organization staff being, you know, sexually abusive and harassing women in the work that they were doing in DRC. And we worked together with Femnet and a local NGO in DRC, where we were putting together a statement that was shared and presented to WHO, HE Dr. Tedros himself, to really take into account the issues that are happening around global health, especially when it comes to preventing sexual exploitation, abuse, and harassment. And the statement was signed and mobilized over 210 civil society organizations all over the world to be part of this statement to say global health institutions, not only World Health Organization, but we know of many others where we have heard and seen cases of sexual abuse and harassment. And how do we play a key role in holding these key institutions accountable, ensuring that they are safeguarding measures in place, ensuring that even perpetrators of some of these cases are held account, in which many cases they're not. So this is a big piece of our work. And just from this letter itself, we've been doing a lot more work and building a coalition around these issues as well. So you'll see a lot more coming out on this, where we're engaging in different other countries and regions, and even health workers themselves, to share their stories, because they is many unreported cases around this, and we want to bring that out to ensure that key institutions and leaders are being held accountable on these issues and changes are being made. So I'm going to stop there for now. And that's just a bit of a snapshot on some of the key issues and the work that we're doing. And I hope this has contributed to do, with the mapping that is being led and with other key stakeholders working on these issues as well. Thanks.
Tikhala, thank you so much. You did such an amazing job of not only showcasing the amazing volume of work that you were all doing, but also those partners involved, and really demonstrating why those partnerships are so important to driving forward some of this progress at the different levels. But also you highlighted the fact that health systems reflect the wider societal issues. So gender inequity in the workplace, lack of representation in leadership, and harassment that women face. And what that results in is worse outcomes, not only for women in the workplace, but for the women in their care. And so I'd love, if you would, Neha, for you to come in as a midwife, as someone who's doing a lot of work around these issues as well, to speak a little bit about the work you're doing and what you're really seeing as some of the challenges to progress in this area.
Thank you, Rachel. And thank you, Tikhala. That was very, very interesting, and we can really relate to so much of that. So I'll start by talking a bit more about the PUSH campaign. I introduced the campaign a little bit, but how we're working at the PUSH campaign is we're working on our goals of improved SRHR and maternal health by addressing the barriers that we're seeing to women's leadership. And we're doing this by taking a systems approach and looking at the different factors that are contributing to midwives' work. So that we're looking at the investment issues, we're finding ways to improve education and training, we're looking at working conditions and what women have, what kind of challenges women experience in the workplace, and then also at leadership barriers and how we can shift underlying gender norms that are actually undervaluing women's rights and their work. So at the center of this campaign is this idea that women's rights, women's health, and midwives are very closely linked. And we see midwives as a solution that looks at gender equity in health, with the ability to provide low-cost, community-based, and very culturally appropriate healthcare solutions for women, which are centered around respectful maternity care, and kind of increases women's ability to choose and make decisions around their own reproductive rights and childbirth experiences. So we know that if midwives are supported globally through their work, they'll significantly be able to improve health outcomes for people and avert close to 4.3 million deaths per year. But right now, what we're seeing is quite dismal. We see that they're being undervalued. We see that they're being underpaid, disrespected while they work in really challenging work environments. And all of this essentially means that there's this entire female health workforce of thousands of midwives, and so many of them are not able to reach their full potential. So we advocate to improve the situation for midwives, which has a transformational impact on their lives, as well as the lives of the women and communities that they work with. So an overall positive impact on gender outcomes. So in my role as regional coordinator, what I've been doing is I've been working to connect with midwifery stakeholders in countries across South and Southeast Asia. So this includes Pakistan, India, Bangladesh. We're looking at some other countries in the region as well. And we're trying to understand the midwifery landscape and see how we can work with target countries to best achieve these advocacy goals in the region. And what we aim to do through our work with stakeholders is to understand how we can support them in amplifying the advocacy asks that already exist, whether that is through connecting allies and donors, through focused communications campaigns, through strengthening midwifery associations, or just working with midwives to amplify their voice, or whatever else the stakeholders are seeing our role to be. So for me, it's been a really interesting process in which I feel like I've learned so much, because stakeholders that we have explored have ranged from midwifery associations to governments to donors. We've spoken to midwives, midwifery educators, obstetricians, gender organizations, both at the grassroots, who are doing some really exciting work around sexual and reproductive health and rights, and also larger movements such as Women in Global Health, who have a shared agenda of gender equity and health with us. We've been talking to photojournalists, we've been talking to independent entities who've experienced the work of midwives and want to support it. We're talking to disability rights activists who are calling for safe birth. And it's very interesting to see how they all have a joint goal because they all see value in the work of midwives. So the advocacy agendas that push, and a lot of the stakeholders we've connected with are pushing for, they're coming from the groundbreaking evidence that was generated by the Midwives Voices, Midwives Demand campaign, which was a companion to the What Women Want campaign by White Ribbon Alliance. And this was really interesting because it's a collection of demands from 56,000 midwives globally. And this piece of work has been so inspirational to all of us because it just ensured that voices from the ground are actually being heard for change. So in the process of exploring stakeholders and really understanding the landscape through their work and goals, I've really understood the importance of collaboration and coalition in this space because we're just using it to have a more inclusive voice to take forward these commitments. A lot of midwifery work, and this is what I've been seeing for many years, is that a lot of midwifery work is done in silos. And the first thing that will often happen when you work in silos is that the voices of the most important groups are left out. This can include introducing new healthcare cadres without assessing the needs, gaps, and community acceptability. It can be changes in education standards and forced higher education for midwives, where we know that direct entry midwives exist and are already providing quality care. It can be adding an exorbitant amount of responsibility to midwives without improving their financial status or increasing their numbers. And what ends up happening in these scenarios is that they lead to programmatic failure and worsen the already negative connotations that are associated with the work of midwives. So on a local level in Pakistan, part of what I do is I work with groups of midwives in setting up and managing midwife-led models of care around the country. So we have midwives as first line, SRH and maternal health service providers working on remote islands, on a boat clinic in the Indus River, at primary care facilities in rural parts of the country. And working on the ground with these amazing midwives in the communities we serve has really helped me see how far removed the end user and midwives often can be from the planning process, because a lot of donor work operates in this hierarchy of people who know best, which will often leave out these groups from the conversation completely. And it ends up being interventions that are kind of happening to them and not with them. So I've been to the MNCH department in Pakistan a number of times. It's a government department. It's a building full of male government officials. Most of them may never have even met a midwife in their lives, and it's just very telling of how a lot of gender programs happen and why a lot of gender programs fail. And some of the largest gaps we're seeing are because no one is actually asking these groups of women what an enabling environment means to them, or what harassment means to them, or how they could be supported to do their work better, or how we can make them feel seen or heard, or even when we speak about the community, how do they want to give birth, or what is the support they need to realize their reproductive rights. And we can have global telehealth and robocall services. We can have diagnostic tools made on apps, but when you don't have access to smartphones or you don't speak English, they won't be of any use to you. So it's very interesting to see how these programs have come about. And in summary, thinking of global health funding is very interesting to me because I wear multiple hats that just give me a lot of context. But from my experiences on the ground and now partnership building and conversations at the regional level, I'm just thinking that we can really start to think about funding in a different way. Midwifery associations are some of the best ways to mobilize this workforce. So are women's groups and community-based organizations who represent women and what they want. And these groups are just stuck in these cyclical patterns of not being able to receive funding because of capacity gaps, or not being able to fill those capacity gaps because they're not well supported. And we're seeing a lot of them now being pushed into the background. But at the same time, we know through the work of PUSH and through evidence from the International Confederation of Midwives and their work, and through all our conversations with midwives and young people and community women, that when they're supported, you start to see some real change around resource allocation, raising community voices, and real ground, like community-based advocacy starts to happen. So the support that they need needs to be defined by them, but some of the gaps we are seeing are around leadership, resource mobilizations, evidence generation, advocacy. And I think we know now that we really need to expand our definition of people who know best when it comes to resource allocation if we really want to start seeing program success. Thank you.
Thank you, Neha. Thank you so much for that. I work very closely with Neha on the push campaign and wider work around midwives, and we often talk about how they, as a profession, are the ultimate portrayal of patriarchy in practice, because they are a predominantly women's workforce working on women's health, protecting women's right to choose, upholding women's bodily autonomy, and as a result of all of the things that come with being a woman in any workforce and within any system, they're excluded from health decision making, they are excluded from leadership positions, and as a result, women and newborns suffer. And so the work of the push campaign and the work it's really trying to do to help wider groups of stakeholders understand why midwives are so essential to women's rights is fundamental to progress. And so thank you, Neha, for giving us such an amazing overview of that work. And as you mentioned, the Midwives Voices, Midwives Demands report, I would be remiss not to immediately pass over to Kristy, who can, I hope, not only tell us a little bit more about that report, but also, Kristy, if you could speak at a more macro level about some of these bigger themes around global health and gender equality that you are seeing emerge, and how we can, as a collective, try and move forward progress in some of these areas. Thank you.
No, thank you, Rachel, and thank you, Tikhala and Neha. Like, I think our remarks are kind of seamlessly, mutually supporting each other, and even from our different vantage points, I think we're witnessing a lot of the same things. So Midwives Voices and Midwives Demands, and I put the link to the report in the chat box so everyone should have access to it. It came out of another campaign that Neha mentioned, the What Women Want campaign. And I think this is how most people are familiar with or know about WRA. And inspired by a group, WRA India, in 2018, it really began with this simple idea, ask those who most use maternal and reproductive health services to tell us what they most need. Ask the clients, ask women and girls. And then we've extended that to midwives and to a variety of other topics and issues. This campaign was really transformative for WRA. And now this approach of ask, listen, and act kind of underlines all our initiatives, all our campaigns moving forward. It's helped us transform our vision, our mission. And we hope really that it's also helping to push global health and development forward as a field as well. In part because first what the campaign really made clear was the impossibility of separating out health from gender equality. While experts, advocates, policymakers often silo, women and girls do not. When asked their top demand for their health, many of them cited food, jobs, security, school. And it was not because they didn't understand the question. It's because they had an acute appreciation for how intimately their health is influenced by social environmental determinants, ones that are then exacerbated by their gender. For example, in my hometown of Washington, D.C., the #1 cause of maternal mortality is actually housing insecurity, which shouldn't have been surprising to anyone, as housing or higher quality housing comes up quite frequently among women who are seeking antenatal care services in the district. Now what's happening in Washington is maternal health and housing advocates are coming together to speak about the harm poor quality housing poses for pregnant people, babies, and their families. Birth justice is equaling housing justice as well. Now let's take that a step further. Imagine going for antenatal care and being told by your provider to eat healthy for you, for your baby, but then not being given any kind of way to be able to do that. To really respond to what women want, we need to make these connections among health and social determinants. And not just in word, which is what we do as a global health community, but in actual deed. You know, this doesn't mean doing everything, which is the first thing you hear as pushback when you say you need to make these connections. But really, it's about intentional partnering, forging alliances among community-based organizations, connecting people with wider resources, looking at their holistic needs and not just the need you're most interested in. Appreciating that advocating for education, employment, food, and housing does not take away from health, but rather improves health outcomes. Now, this is a systems approach, and it has real challenges within the current health funding environment. When the health community discusses system strengthening, which it does all the time, it means health systems. They're not looking at the wider system. However, we know we can't plug one hole in the wall and call it done, as much as that's what we have tried to do, and to diminishing returns.
I think he's being funny, but yes.
Sorry, what was that?
Isabella, I don't think you're on mute. She's gone on mute. Carry on, Kristy.
Okay, okay. So given the wisdom of women and girls, why aren't we really listening to them? And there's a lot of reasons. You know, talking to affected people, getting their input on policies, programs, decisions that govern their lives is not rocket science. But I often like to quote a song by the Indo Girls. Many of you might know them, they're a folk band. But the hardest to learn is often the least complicated. There is more lip service in global health than ever before to the importance of listening and valuing lived experiences. But behind closed doors, the health community is not really keen to do it. Many perceive it as a PR exercise or think they already know, and so they go about it really superficially. Meaningful community consultation takes time and hard work, and that is often under-acknowledged, underappreciated, and under-resourced. Because truthfully, there's a lot of real disdain for listening to ordinary people's opinions, especially women's and girls. Those attitudes are really, really prevalent. I've been shocked and dismayed since really taking on this campaign, how much people really do not actually want to listen to women in communities. In part because I think health is really overly technocratic and ignores the importance of political solutions. You know, throughout the MDG era, there was this underlying strategy to depoliticize health, thinking it would gain greater buy-in. You know, insider tactics, grass-top influencers, and technocrats were primarily used to move the needle. And this worked to some degree and for some time. However, you know, as we see the plateauing and the regressing of key indicators in the years even before COVID, it suggests we've reached the extent of this strategy's success. And continuing in this way really ignores the reality that in most places, the obstacle to health is no longer technical in nature, but political. What's frustrating is there are lots of ways to successfully address these issues now in our hands. There just isn't the will to do it. And a lot of that is because it affects women and girls and gender diverse people uniquely. And the health community continues to let people get away with that. In addition to being overly technocratic, we fetishize technology, innovation, the search for the silver bullet, in large part because we're not really as interested in changing the status quo as we want to be. And we're not really interested in changing our behaviors, which is what actually will bring a new world order, one that is founded on principles of racial and gender parity. Now, technology alone isn't going to move us forward. We need to couple it with really meaningful human engagement and people power. Otherwise, it can actually do untold harm. You know, take our What Women Want campaign. Since that first campaign, we have developed a chatbot. I have about 1 minute left, and that's great because I'm about to wrap up. We've developed this chatbot so others, with our support or not, can readily and quickly apply sort of this ask, listen, and act methodology to related topics, from GBV to women in the workforce to youth well-being. You know, for us, the miracle of this technology is it can provide real-time analysis of open-ended answers, kind of lessening the time between demand and seeing a result. But what it can't do, nor should it do, is what made the campaign so effective: people. It was people who got the impressive results, and they are impressive. Hundreds of millions of dollars, 40 plus policy changes, upgrades to 40,000 health facilities. But it was people that really fostered trust. It's people that sparked inspiration. It's people that created a shared sense of purpose. So just last point, scientists have really identified sort of three major forces, social scientists, that collectively bind together democracies: strong institutions, shared stories, and extensive networks with high social trust. It's really this last piece that is also key to successful health and gender programs, be it advocacy or implementation. And so I would say if you have one real takeaway, it's invest in people. And let's stop talking about it endlessly. Let's stop having the McKinseys of the world develop theories of change and PowerPoints and facilitating strategy meetings, and just really start giving people opportunities to participate in decision making. Again, it's not rocket science, but it does require faith. It requires faith in people. It requires us so-called experts to unmarginalize those we accuse others of themselves marginalizing. So, thank you.
Thanks so much, Kristy. That was incredible. And I, as someone who has worked with so many organizations in the global health and gender equality space, the amount of times that I've spoken so much about the need for this fundamental shift in the way things are being done, and kind of being met by like, yeah, and then you're like, well, if we're not going to do it, if you guys are not going to do it and aren't actually going to believe in this and trust that we need to shift the way in which we're doing things, then what hope do we have right now? So I really feel what you said, that need to listen to what people are wanting and to respond. I heard recently at a conference, I heard Erica Chenoweth speak, and if none of you know her, go and look her up because they're amazing. And she was saying that in something like, someone can correct this quote later, but for the visual, but something that like in 2009, 9% of the world was under autocratic regime, and now that figure is 34%. And where people-powered movements have been historically have created the biggest changes in society, right? It's always been women-led, people-powered movements who have been able to drive the most significant amount of change. But regimes have figured out how we do this, and we haven't figured out a counter response. And the result is that we are seeing these rollbacks in women's rights all over the world, and it's terrifying. And of course, Roe versus Wade is one example of that. The right wing were able to sneak in 2 people on the Supreme Court, get the result that they need, and now we're all living with the repercussions of that. And it's not just in the US, it's globally. And so that was a big link to make, but I've spoken about people-powered movements. I've spoken about the US and Roe versus Wade. And so at this point, I want to bring in the amazing Juna to speak a little bit more about how have you been seeing this work as a people-powered movement, this connection to the political landscape and the results that has on women's rights around the world. I'd love to hear a little bit more from you and about the work that SheDecides has been doing.
Thank you for that, Rachel, and all the panelists. Actually, when I was listening to the other panelists, I really wanted to say yes, really wanted to confirm that this actually tapestry, all this, as our title suggests, our conversation suggests, that we're all connected, and how it's people, it's women, young women and girls that should be at the front of the movement. And during just discussing about it, I wanted to zoom in with how SheDecides has been convening different actors. And just recently, during the Brussels SheDecides +5, we wanted to capture this different but interconnected aspirations on gender equality, reproductive health rights, and broadly global health policies and programming. And for some people, they think that we convened during that 5 years of the movement as to celebrate, but actually we're not celebrating. We're convening to recommit and strengthen those commitments during the 5 years ago. And I think that's the role of SheDecides, has always been a convener and political voice. Kristy has been talking about how global health spaces has been depoliticizing, but we want to bring that political aspect to it, and that political situation to it, because when we look at the context from the last 5 years, SheDecides started as an initiative because of the global gag rule, which is technically and mainly a human rights issue, and then well, it was just repealed because of the different change of government. But again, we're here. Spaces are shrinking because of the Roe v. Wade. And this has been the highlight of the She Decides conference, She Decides +5. It's really to voice concern on the challenge of how Roe v. Wade rolled back abortion rights, not only, as you mentioned, Rachel, in the US, but it sets this devastating global precedent and emboldening anti-choice opposition groups elsewhere, especially at the South-led South governments. So it's necessary to work with different actors, just having this umbrella political message that that we have to have this strong political message that cuts across sectors, across governments, across donors, and including young people. And this is where She Decides comes in. And this we saw this highlight that there's an opportunity to organize, to strengthen support funding services, being mentioned by Neha, Kristy, and Tikhala a while ago, how there's limited funding and fundings are being siloed. And but also not only services being funded, but also activism and movement building is needed to drive that change, especially at the national level. There's also one of the highlights on the importance of power sharing and addressing the patterns of decolonization, where is actually we felt that is central to effective movement building. As you see, these issues are actually colonization at hand. These are all colonized discussions. So we want to argue that we cannot address this inequality if we want to address these global inequalities. So this really the stark reality of many laws restricting women's access to abortion, and also those who are criminalized LGBTQI, because these are all issues of colonial relics. Unequal power relations related to reproductive health and rights cannot be effectively challenged unless they have also been addressed internally and within the bodily autonomy movement. And this is also where governments come in, the importance of including them, but also ensuring that they know what's happening. And that's why it's important to include South-led governments. We should not shy away from how this can all be political, and we have to make political leadership visible. But at the same time, putting political political aspects to it shouldn't also remove young people at the table. So it should be young people who sometimes are not included at the table should be part of it. So we as SheDecides facilitate and open doors between those who hold power and those who do not, and we want to find that commonality. And as a young person, we're at the vital heart of this gains, successes, and actually demands. We're part of the DNA of movement building, of understanding that political power. There's a lot of dynamic with policies and political institutions and governments, but at the same time, we have to have that shift of power within these conversations.
Juna, thank you so much for that. Thank you for your contribution. Thank you all for your contribution. We've got about 10 minutes left, and I am desperate to make sure we end on a positive note, because it is scary what is happening in this space, both global health and gender equality more broadly. So I'm going to start with you, Juna, and then go back around 1 minute each. What is the thing that makes you feel most optimistic about the work that is happening, whether it's your work or what more widely in the space? What is it that makes you the most optimistic about the progress that we're making or could make?
I think it's really the broadening number of young people and all their diversity that's being included in the conversations, and most especially within gender equality in global health. They're young professionals, they're young health workers, they're young health professionals and young feminists. I think we always, as we mentioned a while ago, look at feminist activists and global health workers as different groups of people, but actually health workers, health professionals, young health professionals are feminist activists. So I think that link, that tapestry has really made me optimistic that the change is happening at this core, at this intersectionalities.
Thank you, Juna. Kristy?
Sure. Yeah, so I've actually been reading this really interesting book, and I highly recommend it to everyone. It's called Strong Female Lead. But within it, the author is talking about change and how it takes place in sort of concentric circles. And this idea that, you know, change really has to start with you, and then those closest to you, and then outside. And I think I am feeling change, even though macro, it is terrifying what's happening intimately. I feel change close to where I am residing in terms of the people I know, the people I'm working with. And again, it's change in minds, and really there are mind shifts. And ultimately, you know, I think that's what we have to do to sort of create sort of a huge paradigm shift. And like, again, those circles kind of build out over time, but it's that really fundamental mind shifts that will ultimately change to really action. And I am hopeful for that. And I think people are realizing how much we actually have to focus locally. For the first time, local action has often always been dismissed as not being as important or as grandiose as, like, you know, high level national action or global things. But I think people are really understanding it's change in the backyard. And if we're not taking care of that, then it compounds itself. So I am hopeful when I look small, and that could lead to big things. Yeah.
I feel exactly the same, Kristy. I've spoken a lot recently about how I have so many friends in different networks, colleagues and friends in different networks who post-COVID have just completely shifted their value system, are giving up work or changing careers or taking breaks, or because especially during the COVID, they saw how quickly institutions were just not valuing them and having to rethink everything. And so it's been, I also see, I'm optimistic about that and what it could create in that shift, especially when the macro is so scary. So I agree with you there. Neha, over to you.
I think I'd agree with Kristy about, I think what makes me feel hopeful is just there is change that I see it at a different level. I mean, some of it is also just the conversations we're having today, which is just, it's so nice to see that these conversations are happening, that, you know, not all conversations are around the same donors and trends and trainings and all of that. There is room to speak about these things. So that's really great. And the other thing is just the micro level changes that we see on the ground in communities. We started seeing a lot of advocacy happening through young people. We've started seeing midwives, you know, go to centers to just kind of protest and ask for their rights. And that kind of like taking change into your own hands is also, we're seeing some really good results come out of that as well. So I think there is hope, and I think the hope lies in all of these pockets that we need to look for it in. Thanks,
Neha. Tikhala?
Yeah, I mean, just echoing what everyone else said, and just to add on to it, I think about two big things, right? And the first one is on partnerships. I feel like the way partnerships have evolved has progressed really well. The way you see government stakeholders working with civil society organizations, working with community members, working with media, you know, that diversity was never there before. And I love that we're at this stage where these kind of movements and these partnerships are coming together, recognizing a need and recognizing the need for us to work together at all different levels. And I think that has been a key impact to kind of just share, and also just kind of sharing from even the work that we've been doing, being kind of a movement that's working with different grassroots organization at a country level, or our different women allies at a country level. Who would have known that they would be able to engage on different high-level events and platforms being organized by the government of France, for example, or another, you know, global high-level institution from the global north. So it really kind of just makes you think how the element of partnership and global connections, or connections being done at a local and a global level, is progressing really well. The other thing is amplifying voices, especially from a grassroots level. I feel like back in the days, there were so many spaces where those who were impacted and affected by these key issues in the global health agenda weren't being heard, or their voices were not in the table. And now you do see the intentional decision to ensure those voices are brought on the table, those diverse perspectives are being brought on the table. I think even speaking from my own personal experience, I think being a Black young woman from a low-income country like Malawi, I didn't think I would ever be speaking in a panel like this, you know? But now we're in the space where we are recognizing the diverse needs, diverse experiences that need to come to the table to inform decision-making, to inform the development agenda. So I think that has been great progress. And just even for my personal journey, I could see that I've been able to voice out different issues from my perspective, from my own community and my own village that I never thought I would have been able years ago. But those spaces are now beginning to open up to ensure that issues are being heard from those deeply affected by these issues.
Thank you so much, Tikhala. And I agree and echo everything that you have all said. And in terms of our work, the work of both Women in Dev and Global Office, one of the big areas that we've been focusing our advocacy is on transforming funding practices for global health and gender equality work. And again, I think that is where there is so much opportunity. We are seeing more funding coming in for this type of work. And for decades, we've been starved in trying to advocate as grass level or global level movements and organizations. How have we got a chance against right-wing or autocratic entities, institutions and regimes? But if we actually start to get that level of money, I look forward to these voices, experiences being surround sound in the work that we're seeing at all levels around the world. So I think that once we start seeing proper money and funding coming in for these initiatives, it's going to transform everything. And so that's where our advocacy is focused and will continue to be focused, because the work that you are all doing needs that funding. So thank you all. Thank you so much for taking the time to be here today. I've got 2 minutes left. Erica will be, I think it's probably not left it enough time to get her to give us a little visual of what she's done so far, but we are going to share it around in the next couple of days so you can see what the first piece of the tapestry of this series looks like. For all of those of you who've joined, thank you so much for giving your time. Thank you to the panelists. Make sure you do follow the panelists online on the various channels to see more about the incredible work that they are doing and their organizations are doing. Oh, Lawrence just said that she can share, so maybe I will quickly flick to was it Erica?
Yes, so let me just share my screen really quickly, and that was incredible. Thank you. So far, this is what it looks like, and it will be filled out and it will have color, and it will really reflect all of the deep and meaningful pieces that were said today. So that was a whirlwind. If you see spelling mistakes, I'm going to correct those also. But yes, this is where it is right now. Thank you so much for sharing your work. Really amazing for me as a graphic reporter to sit in and hear all that's being done in this space. So thank you.
Erica, it's so amazing. I love it. I love it. I'm so glad that we're doing this now. I wasn't sure how it was going to go, and now I'm even more excited about the next 5 series. So thank you all, and thank you to my friends and colleagues who have been a part of this first panel. I started with global health because I know you all, and I know you'd be so supportive of this work. So thank you for giving your time. Thank you to everyone who attended in the audience, and yeah, I'll see you all soon. Thank you.
Thank you.